folks, welcome again to your Insight of the Week. And today we thought we'd do something a little different. We'll be doing a few of these scattered throughout, but today's our first one. I'm really excited for this series. I think it's a great idea. I'll even give Anthony, whose birthday is today, a tiny little bit of credit. This was his idea. I think it's a great one. And the idea is what to expect when you're expecting to have surgery. Okay, so we're going to go over individual surgeries, what to generally expect. Now, understand with all of these things, your experience may vary, but we're going to give you some general things to think about, general expectations that you can expect, and we'll go from there. Okay, so the first surgery that I think we see a whole lot of these are knee replacements. Okay, so that is, you've had arthritis usually for years, it's gotten very bad, and the doctor has told you that it is time for a knee replacement. Probably a lot of nerves that come with that, so a few things to think about. First, what's going to happen post-operatively? After you're done with your operation, they're going to stand you up and they're going to have you walk around your unit, whether you're in the hospital or in an outpatient center, to see where you go next. And most of the time they're going to try and send you home. And you'll probably oftentimes do some home therapy if they think that's appropriate, or if not, they think you're ready to come see us. Great, we'd love to see you. Now, when it comes to that, my suggestion is make sure your therapy, your outpatient therapy is scheduled. Usually these surgeries don't happen like a week after you've decided you're going to have a knee replacement. It's usually months. So what I think is really best to do is make sure you're scheduled already ahead of time. Call our clinic, give us a call, let's get you in. That way you're scheduled and ready to go, so it's not an emergency situation trying to get you in. Number two, what to expect. I hate to say it, but you're going to feel a little pain. It's not the most comfortable thing. After a knee replacement, you're usually going to have a big scar from here to here, thereabouts, where they have cut in there to do the knee replacement. You will feel some level of pain. Now, where that's going to be is individual to every single person, every single patient. So I can't tell you how much that's going to be, but pain is part of it. That's part of the healing process. That's going to be somewhat normal, so don't be afraid if you do feel some pain. Swelling is going to be very common, especially around the knee. Now, that's probably one of the most common things. That's going to be one of the things we're going to work on first. We'll talk about that in a minute. But yes, swelling is going to be a part of it, okay? Particularly around the knee. So in terms of your rehab, let's talk about what the rehab kind of looks like here, okay? First thing that we're going to be looking at is how painful is it? How swollen is it, okay? The swelling is going to be a big part of our goal to get that swelling down, because that's going to help all sorts of things, particularly your ability to fire your quad muscles and strengthen those muscles, but just to be able to walk and all of that. So we will be looking at swelling. Ice is going to be your friend. You will probably be doing a lot of that. The next thing we're going to really be looking at is range of motion. Now, the most important thing that people tend to think is, well, it's a knee, it has to bend. And yes, knee bending is going to be a part of it. But almost more important, because you can't actually walk normally without this, is knee straightening. So when you first get out of the hospital or out of the surgery, one of the things you're going to notice is they're going to have you resting that knee straight as possible, okay? That's going to be super important, because once you can get straight, you can walk normally. So that's going to be a really important part to that. People tend to think it's the bending that's the most important. It's not that it's not important, it's very important. But the straightening is usually our first goal. And if we don't get you straight fast enough, then we have a really hard time doing it. And so getting straight as fast as possible is going to be part of it. We will be looking at strength, particularly of those quad muscles, your ability to squeeze those quad muscles, but also the hamstrings, the calf. And that brings us to the next part, kind of red flags, okay? Things that we worry about, things that we're going to be looking at in terms of like, hey, we don't like to see, okay? This is uncommon. I don't want you to think these are common things, but these are among the more common things that we're going to be looking for to rule out. We don't want to see these things. So in terms of red flags, around the scar, I mean, it's not going to look beautiful. It's a surgical incision, but we really don't want to see a lot of pus or smells or things like that. Really red around there. Signs of infection is what we would be looking for. So those are bad things. If you see that after your surgery, you're gonna be calling the doctor, or we're gonna be calling the doctor pretty quick. The other thing that we look for is particularly swelling below the leg and calf pain. Lots of deep calf pain, because one of the things that can happen with this is something called a blood clot or a deep vein thrombosis. These are not common, but they are things that we look out for you, and that you should be looking out for severe calf pain. The big thing with that one in particular, and what's important to know, is that it's most common if you're not moving. So if you're not moving, that's more likely to cause that kind of a problem. So immediately after that surgery, as I said, they're going to stand you up and they're going to make you try and walk. So the reason for that is not just because they need to evaluate whether you can walk, but also to get you moving. The idea is we want you to start moving, okay? So in order to prevent a deep vein thrombosis, or DVT is what they're called, which is a blood clot in the lower leg, which is more common after a knee surgery, is to pump the ankle up and down. So one of the first things that they might teach you as soon as you're done with that surgery is to move this ankle up and down as often as possible. And they will give you other things as well that are particularly related to that. But that's one of the things that I would probably be the first thing I would probably tell you to do when you come to rehab to see me is, hey, move that ankle up and down, okay? Get that calf moving, get that fluid pumped up, okay, to reduce the risk of that. So those are the big things that we typically see. You should be, in most cases, weight bearing as tolerated. That means you're allowed to walk, move and put weight on that leg as much as you feel like you can. Oftentimes you will be using an assistive device at first because you can't put all your weight on that leg. That's not abnormal. So those are the big things. If you have any questions, you can always give us a call ahead of your surgery. We'd be happy to talk to you ahead of time, give you some more information. But we're hoping that this kind of video would help people out, help people feel a little more comfortable going into those surgeries. That's our Insight of the Week. We'll see you next week.